Patient-reported outcomes, commonly known as PROs, are health outcomes directly reported by patients, without interpretation by doctors or anyone else. They're usually gathered through carefully designed questionnaires that ask about symptoms, daily functioning, mental health, and overall quality of life. As healthcare increasingly focuses on value-based, patient-centered care, PROs are playing a more important role. They fill a critical gap by showing how treatments affect people's everyday lives, not just by lab results or test scores. A patient can be considered successfully treated from a clinical standpoint, but still face challenges in their daily life. Ignoring the patient's own perspective can miss the full picture. Take early-stage breast cancer, for example. A patient may complete treatment and be declared cancer-free, but still struggle with pain, fatigue, emotional distress, or reduced mobility. This phase, known as survivorship, is where PROs become invaluable. By asking patients directly, PROs help us understand ongoing issues like pain severity, mental health, and quality of life. Clinical data tells one side of the story, while PROs tell the other. Together, they provide a much more complete view of health outcomes. One widely used PRO questionnaire is the EORTC QLQ-C30, a questionnaire designed to assess quality of life of cancer patients or survivors. It includes 30 core questions covering symptoms like pain or fatigue, ability to perform daily activities, emotional well-being, and social functioning. There are also additional modules tailored for specific cancer types and topics like financial burden of treatment or communication with doctors. These tools help researchers and clinicians gather meaningful information straight from the patient's perspective. Creating reliable and fair PRO questionnaires isn't easy. The questions must be clear, easy to understand, and culturally sensitive. Language used in the questions must be neutral and inclusive. Designers also have to consider other factors, such as sample size, the number of questions, and response scale. To be scientifically valid, PRO measures must undergo rigorous testing for reliability, validity, and responsiveness in a large group of patients. Only after passing these tests, and often being published in a peer-reviewed journal, are PRO tools widely adopted. Patient-reported outcomes are becoming a key component of modern healthcare, helping to bridge the gap between clinical indicators and the lived experience of patients. Whether it's in clinical trials, routine care, or health policy decisions, PROs provide essential insights that traditional clinical data alone cannot. They bring the patient's voice to the forefront, helping providers, researchers, and policymakers make more informed, compassionate, and effective decisions. By capturing the real-life impact of treatments, PROs are making healthcare more human.